Best antibiotic for sinus infection. What you should know. If you're dealing with a sinus infection, you probably want relief as quickly as possible. Many people have heard that a Z-Pak can treat sinus infections, but the truth is more complicated. A Z-Pak is not usually the best antibiotic for a sinus infection. That's because most sinus infections are viral, not bacterial, and antibiotics do nothing against viruses. When a bacterial sinus infection does occur, antibiotics can sometimes be recommended. But in most cases, healthcare providers prefer other medications over a Z-Pak. So, what is the best antibiotic for a sinus infection? Let's break it down. What is the best antibiotic for a sinus infection? The right antibiotic depends on your medical history, allergies, and the severity of your symptoms. Your primary care provider will determine whether antibiotics are necessary and help you find the safest and most effective option. For many people, amoxicillin is the first-line choice. When prescribed for up to 10 days, it works well for bacterial sinus infections and is usually more affordable than other antibiotics. Other effective antibiotics for a sinus infection. Amoxicillin with clavulanate. Augmentin. This combination antibiotic is often recommended over amoxicillin alone because clavulanate helps protect the medication from being broken down by bacteria. Augmentin is commonly used for sinus infections, ear infections, and urinary tract infections. Doxycycline. This is a tetracycline antibiotic that works well for people allergic to penicillin. It treats sinus infections as well as other conditions such as acne, chlamydia, and UTIs. Cefixime, Suprax, a cephalosporin antibiotic that can be an alternative for people with penicillin allergies. While effective, it tends to be more expensive and may cause side effects like diarrhea or stomach upset, so it is not usually the first choice. Fluoroquinolones, levofloxacin, moxifloxacin. These antibiotics are reserved for people who cannot take penicillin. They are effective for sinus infections, but are generally used when other options are not suitable. Z-Pak and sinus infections. What you should know. When people think about treating a sinus infection, a common question comes up: is a Z-Pak the best antibiotic for a sinus infection? A Z-Pak is a 5-day course of azithromycin, Zithromax, an antibiotic often prescribed for bacterial infections. It has been used to treat upper respiratory infections, including certain sinus infections, as well as conditions that cause headaches, sore throat, congestion, and runny nose. When is a Z-Pak used for a sinus infection? Most sinus infections are viral, not bacterial. This means an antibiotic like a Z-Pak won't help. And even when an antibiotic is appropriate, azithromycin is rarely the first choice today. In the past, the Z-Pak was widely prescribed because it was convenient. But over time, many of the bacteria that cause sinus infections have become resistant to azithromycin. As a result, there's a high chance that a Z-Pak won't cure a bacterial sinus infection. Healthcare providers now usually recommend other antibiotics as more reliable options. Side effects of a Z-Pak. Like all antibiotics, a Z-Pak comes with possible side effects. The most common include nausea, stomach pain, constipation, diarrhea. Rare but serious side effects include allergic reactions, liver problems, and dizziness. More importantly, Z-Pak use has been linked to serious heart issues such as arrhythmias, irregular heartbeat, and an increased risk of cardiac death. Treating sinus infections without antibiotics. Because most sinus infections are viral, antibiotics, including the Z-Pak, won't be effective. Instead, treatment focuses on symptom relief until the infection resolves on its own. Options include getting plenty of rest and fluids, using steam therapy from a vaporizer or hot shower, taking zinc lozenges early in the illness to help shorten symptoms, managing pain and fever with acetaminophen, Tylenol, or ibuprofen Advil, using decongestants like pseudoephedrine, Sudafed, or loratadine with pseudoephedrine, Claritin D. Trying nasal sprays such as fluticasone to ease inflammation. Your healthcare provider can determine if your sinus infection is bacterial or viral based on your symptoms and how long you've been sick. When to see a doctor for a sinus infection. Many sinus infections improve within 7 to 10 days without medical care. But you should see a healthcare professional if your symptoms last longer than a week without improvement. You develop a fever above 101 degrees Fahrenheit or one that lasts more than 2 days. You experience severe or persistent headache, sinus pain, or chest pain. You notice wheezing or a cough that becomes prolonged or bloody. Most sinus infections are caused by a virus, not bacteria. That means antibiotics aren't usually necessary, and taking them when they're not needed can actually do more harm than good. If your symptoms last longer than a week or start getting worse, contact your primary care provider. If an antibiotic is appropriate, amoxicillin is often the first choice, with other options available depending on your medical history and allergies. For more trusted, science-backed health information, be sure to subscribe to HeInfo, your all-in-one destination for reliable guidance on medications, treatments, and everyday health questions.